Hey guys, this is Siju Jacob here, and we have some free time, so I thought I'll catch up on some of the questions that that you guys have posted on our Facebook page. This is from Dr. Vijay Kumar, Dr. Ashok Singh, and Dr. Sujit Kumar. You guys wanted to know the right way to cement a fiberglass post. Now, I don't know whether there's a right or wrong way, but I'll tell you what we do every day in our clinical practice. Now, I learned this about 8 or 9 years ago from Marjorie, endodontist from Netherlands, and I pretty much haven't changed anything in the last 8 or 9 years. So let me show you how we go about cementing a fiberglass post in our practice. The cementing of the post can be divided into three different stages. First of all, you need to prepare the canal to receive the post, and two, you need to prepare the post itself before cementation, and finally the actual cementation of the post. So step one is to prepare the canal. Now, very often just before cementing the post, we need to make sure that the canal is nice and clean, the walls are clean. The best thing to do this under the microscope and make sure the walls are clean. You can either use alcohol to initially remove sealer remnants and from the walls, or you can even use air abrasion and then scrub it out, and you can follow this with ultrasonics. So here you can see we're using a micro brush. Even after washing it out, you can still see a bit of remnants, and you can use ultrasonics to actually flush out the remaining remnants on the walls. Here you can see we use an ultrasonic, and once the ultrasonic is done, you can inspect the canal walls. So we don't enlarge a canal just to place a post. We use whatever space is available. In this case, you can see there's quite a lot of space. So even the largest post that we have is quite loose. So we put two posts. So once you make sure that you're going to use both these posts for cementation, you can remove these posts and then give it to the assistant for preparing. In the preparatory stage, ideally this should already be placed in 24% hydrogen peroxide, and then before placement they are etched with orthophosphoric acid for about 5 seconds and then rinsed with water. And once that is done, you apply a coat of silane or a ceramic conditioner over this post to promote the bonding of the post to the restorative material. So once that is done, the post can be set aside and taken off just before bonding. The next step is to etch the canals. If there's enamel available, then etch the enamel first for about 15 seconds. And once that is done, you can apply etchant onto the dentin for another 15 seconds. So it's about 30 seconds for enamel and 15 seconds for dentin. And then rinse it out with water. And I like to dry it completely and then moisten it again with 2% chlorhexidine soaked onto a microbrush. So we moisten it and then we apply the bonding agent. For bonding agent, I like to use dual cured bonding agent. I'm using Excite DSC from Ivoclar. It comes as two components. In this case, I'm using a micro brush, which is an Endo micro brush. So it's quite thin. And one part contains the powder and the inner part contains the liquid. So you press it inside and mix the two together, so it becomes a dual cured bonding agent. And then we apply that into the canal walls. Apply it all over and make sure that it doesn't pool in the canal. So if there's extra bonding agent pooling in the canal, then we blot it out with paper points or microbrush. We inspect it under the microscope to make sure that there's no excess bonding agent. And once you make sure it's a bonding agent only on the walls, we cure it. And the next step is to apply the dual cured buildup material. So we're using Luxacor. These come with their own tips, which are plastic tips in different gauges. So you can use that as delivery, or we use what we call AccuDose from Centrix. These are metal needle tubes which come again in different gauges. So you can select the gauge. I find that these reduce voids or air bubbles, so I prefer these over the plastic ones. So you select the appropriate gauge. They also have their own plungers. Now these plungers are inserted into those needle tubes, and then the whole assembly is fit into a composite gun and then delivered into the canal space. So what we do is we first select the delivery tip to whether or not it fits or it goes all the way and touches the residual gutta. So here you can see it's quite big for this canal. So we don't use that, we select a thinner one. So you can see a thinner one going all the way and touching the gutta space.
So you can either use this, but like I said, I prefer the AccuDose ones. So you can see me testing out the metallic tips. I make sure that it's going all the way, and once I know that it's fitting in the canal, I keep it aside. I make sure I have my needle tube as well as my plunger and the gun ready, and then we start mixing the dual cured build-up material. This has to be done really fast because this can set quite rapidly, so you want to make sure you deliver it before it sets. Remember, it's dual cure. So we mix it and then load it really fast into the needle tube, and then load it onto the composite gun. After inserting the plunger, put it onto the composite gun, and then you're ready to cement or extrude it into the canal space. So I like to extrude a little bit first into the canal space. You can see we put a little bit, and then I like to shake up that initial increment with a probe or a thin plugger. I find that this reduces air bubbles, and then I fill the remainder of the canal with the dual cured build-up material. And once that's done, I place the pores. So you can see I place the first pores, and in this case I'm putting 2 pores, so I place both these pores. And once the pores are placed, I don't touch them. I make sure that it's light cured from all directions. And once it's set, you can go ahead and do your trimming. You can trim out the extra pores that is sticking out with the burr. And once that's done, you don't want to leave any part of the post exposed to the environment, so you got to cover this. So I prefer to cover this, and before placing the composite over the exposed post, we apply a little bit of silane again, and then place the composite over that. You can place whichever composite or build-up material that you want, and then light cure again, and then do whatever trimming it is that you want to do. And once it's done, you can do your finishing.
Alright, so that's how we go about cementing a fiberglass post in our practice. Let me know whether you agree with it or not, and if you have any comments, queries, etc. just log on to our website, or we'll show you the links that come after this, and keep in touch.